So Roland, if you can just start by telling me what you first thought when you heard about the coronavirus and the lockdown and how it might affect your treatment.
Initially, my feeling was that it was probably not going to affect me in a huge way, because I thought, well, at least I'll be at home, I'll be safe, be with my family, so that's not a bad thing. And at that point, my treatment was kind of concluded, so it timed it quite well. But then subsequently, I got sort of a new diagnosis that the treatment I'd been having hadn't actually affected the tumour. So I needed to sort of reconsider the path, and that's where I'm sort of a bit stuck at the moment.
And you were diagnosed with cancer 4 years ago, and you're about to embark then on some potentially life-saving treatment. Tell me about that.
So so I got diagnosed 4 years ago with metastatic melanoma, and the idea recently was that the immunotherapy treatment would be used from January onwards, and that would allow me to boost my body's immune system to fight back against the melanoma that had spread to my pancreas. That hasn't worked. So what they would normally do in this situation is move to looking at clinical trials. So looking at treatment that isn't necessarily available on the NHS at the moment, but that can be explored through private healthcare or other means. But obviously, all medical efforts are being used to combat coronavirus at the moment. So although I'm being treated by Derriford Hospital in Plymouth, and they have good connections with the Royal Marsden in London and Christie's in Manchester, everything's kind of on hold until the coronavirus it can be kind of brought under control and dealt with.
How do you feel about that?
It's a really difficult one. On the one hand, I can see that the coronavirus is absolutely a priority, and the NHS is under huge strain, and there are a lot of people being affected by that. On a really personal note, if I don't get access to the treatment, then the suggestion is that I only have a few months to live, and I've got a young family and a wife. We only got married last year. So that kind of, on a really sort of selfish note, I want everyone to just stay at home so that myself and people like me can get access to that treatment more quickly, and the people that work in areas like cancer treatment can get back to doing that really valuable work and not having to be on the front line helping those people that have succumbed to coronavirus.
It's quite interesting at the moment, isn't it? Because obviously we're getting every day that the amount of people who died, and those numbers are absolutely staggering. But of course, there is the effect that other people will die because of the coronavirus, but not having the coronavirus, but because their treatment, like yours, is halted.
Yeah, it's really difficult, and I think something that's helped us in a weird kind of way is we've got 4 kids. I have 3 teenage stepkids and a 5-year-old of my own, and trying to explain to them why they can't go out and do some of the things they would normally do, especially when the weather is so nice, is about saying, look, if you go out and have an accident, and that means an ambulance has to come out and pick you up and take you to hospital, that takes resources away from an NHS hospital that could otherwise be helping to support people with coronavirus. So I think it's those knock-on effects, those ripple effects that everyone's starting to recognise, but it's quite a difficult one, and having to sort of break it down and explain it to children does sort of help you understand it a little bit better, I think.
And Roland, you're having radiotherapy at the moment. What's that like when you go into hospital? You must be a bit concerned about catching the virus yourself.
Yeah, it's an interesting one. So I'm due to start that on Friday this week. I've actually been sent some PPE by a family friend as well, so I'm sort of ready to get going. But I have to admit, there's a huge amount of anxiety around that. Even today, I had to go to my village GP surgery, so a very small Cornish village GP surgery, just to have blood tests to make sure I'm ready to have the treatment. And even that, you go in and there are tables and chairs put up to create a sort of false barrier between you and the receptionist. The nurse taking my bloods had to do 3 changes of gloves just to make sure that she was being sterile and clean and not passing anything on. And then I had to leave the surgery through another door because there was another patient who'd come in for their appointment. So if that's what it's like for a small Cornish surgery with 2 patients, then going into a large hospital like Derriford does fill you with a certain amount of anxiety, and normally, my wife would come with me to sort of keep me company and for a bit of support, but to minimise the risk of any kind of further infection, she's going to stay at home. I'm just going to take myself and get myself home again. But even so, it's a case of having to plan and think, right, do I need to get changed once I've left the hospital. I take all my clothes off, put them in a bag, get ready to put those in the wash. The same as, you know, anyone on the front line in the NHS might do as well. So it's trying to take all those things into consideration.
And you've been very frank in your blog and your podcast about how the coronavirus could affect your chances of survival. Why have you done that?
So I started the blog when I got my original diagnosis, and part of it was to help me. I've always found writing to be a great source of kind of untangling my thoughts and feelings about things, but also when you have something like this that affects you and your family, people want to know what's going on, so it's helpful to write it all down. And I think through writing it over 4 years, people have really found it useful and really come to it from an angle of appreciation, that I've explained things in an open and honest way that they've maybe not been able to explain to their loved ones and their families, going through cancer or anything like that, mental health issues as well. It's all featured in there. And the coronavirus thing just kind of adds an extra angle to it, I think. And you know, it's almost like keeping a diary. You have to put in there everything that you're feeling, everything that comes up. And some of it is sad, you know, as you might expect, and a bit tragic, but other bits of it are actually, you know, there is comedy in there as well. There is humour to be found in all of this stuff, which is, I think, just something that the British do quite well. And, you know, that's something I try to capture in my writing.
Definitely. And are you well enough at the moment to be enjoying life with your wife and your family?
Yeah, physically I feel pretty good. It's not a problem to, you know, go out in the garden. I haven't, apart from going to the GP surgery this morning, which was quite exciting. For the first time in 4 weeks, I got to leave my house. But we've been in the garden, we've been doing things in the house. We've tried to make the most of what we've got. We've painted rainbows and done the blue hearts for the NHS. We go out every Thursday and clap for the NHS. I've made my stepdaughter a sort of bespoke netball hoop out of an old plant pot because she loves netball, so she's been practicing with that. Trying to do as much as we can to just keep busy, but I think there is a huge mental health toll on these things when you're just waiting, and to get that call from oncology when you're already on lockdown, which basically says there's nothing else we can do at the moment necessarily, so you might only have months to live, and at the same time the news is saying the lockdown might go on for months, and then having to tell your parents and your siblings and other relations and friends and so on over the phone or over email or whatever, might not get to see you again, might not make it to Christmas, is really hard, you know. And I think we've come to terms over the last few years with dealing with quite difficult decisions and situations, but it doesn't make it any easier when you come up against something like this, which is just unique in not only my lifetime, but I think in my parents' lifetime as well. You know, it's a sort of multi-generational issue.
And you mentioned your young family and your 5-year-old son. I mean, I presume that your absolute motivation is to keep going for them.
Absolutely. And I think, you know, I've learned over the last 4 years or so that you do this in bite-sized chunks. So today was my wife's birthday, so we've, you know, celebrated that a little bit. It was a bit strange to receive PPE in the post on her birthday. I think she thought it was a birthday present, and then was a little bit surprised to see what it was when I opened the box. And then, you know, we look forward to hopefully the lockdown being lifted at some point. It's my 40th in July, so I'm trying to aim for that one as well. And hopefully seeing the kids go back to school in September perhaps. But it's just a case of trying to stay positive and trying to keep things moving in the right direction. And the writing helps me do that, and it also helps other people who I would normally be seeing on a regular basis to feel a little bit connected. So both, you know, we feel connected to them and they feel connected to us, and that really helps as well.
Well, Roland, it's been lovely to speak to you, and we all wish you the very best. Thanks very much.
Thank you.